Pfizer is expected to ask the FDA to authorize its COVID vaccine for children under 5 as early as today. CNN has just confirmed this, first reported by the Washington Post.
So if emergency use authorization is granted, children as young as 6 months old could have access to a 2-shot regimen by the end of this month. I want to bring in CNN Chief Medical Correspondent Dr. Sanjay Gupta. Sanjay, this is welcome news for a lot of parents, but it's also a little bit quirky. Can you explain?
Yeah, it is a little bit quirky because you remember last year when we talked about this, end of last year, we thought maybe this was going to be sort of second quarter of this year. Back, a couple of weeks ago, Dr. Fauci said this sort of authorization request may come within the next month. So it was the first time we sort of heard the maybe accelerated timeline. And now we hear that the request, at least for authorization, is imminent. It could happen really today, any day soon now. And if that happens, possibly by the end of the month, there could be an authorized vaccine for children under the age of 5, which I know, Brianna, you've been thinking about a lot lately. A lot of parents out there have been. I think there's a couple things that have been going on here. One is that I want to show you the dosing, first of all. When you look at the dosing for children under the age of 5, compare that with dosing for older people. They wanted to try lower doses, understandably, for these young kids, and they wanted to get the right number of doses as well. What they found was that in 6 months to 24 months, 2-year-old children, they seemed to have good immune response based on this dosing. It was 2 to 5-year-old children that they thought maybe, look, do we have to add another dose, a third dose? And that was originally what was sort of pushing the trials a little bit later. Now I think what they're basically saying is, why don't we go ahead and apply for the authorization for the 2 doses? We're continuing to get data on 3 doses. That data should probably be here by the end of March. And at that point, you should have a lot of children already able to get access to the vaccines, and then they'll determine later on whether a 3rd dose is necessary. It's kind of what happened with adults as well, if you remember. So it seems like that's what the thinking is there. Lowest dose possible, figure out the right number of doses. That data is still forthcoming, but the 2-dose authorization request may come in very soon.
So what do you think parents will do here? We've seen some reticence of folks to get their kids vaccinated. For some people, I will not be one of them, to be clear. But do you think the parents are going to say, yeah, let's get this done?
Well, I could show you what has happened so far. If you look sort of just based on the age groups that the vaccine has already been authorized for, you'll find that it really does go significantly down when you start to get into the 5 to 11-year-olds. So 22% thus far have only been vaccinated. So I don't know. It's tough to say what that's going to mean for younger children. I think a lot of it will depend on sort of what's happening with the pandemic at any given point as well when the vaccine is authorized. Let me show you just weekly cases. We pulled this. People often ask me, what is going on with children overall in terms of their likelihood of being infected with this? And I could show you that it's very clear Omicron really changed the infection rates among children. It was sort of bouncing along there for some time, and then when you got over the last month or so, it really skyrocketed up. It's starting to come down now, and I think people are going to pay attention to that and see what's happening in terms of their own willingness to get their children vaccinated. But it's pretty clear when you look at some of these early trial results, and we'll see what the FDA specifically says, but when you look at some of the early trial results in terms of providing immunity for these children under the age of 5, the vaccine can be very effective. It can help prevent infection and potentially help prevent some of the long-term symptoms that we talk about as well.
Yeah, we said at the top, it could end the pandemic or this phase of the pandemic only if people take it, right? It will only have a public health impact if kids take it or if parents let their kids take it, not 20% like we're seeing 5 to 11-year-olds. It's got to be much, much higher than that. And Sanjay, I'm sorry to go back on this again. The initial tests of the 2-dose vaccine ages for the higher range, 2 to 5 or 2 to 4, didn't show much antibody production or didn't show much increase in boosted immunity. Totally safe. They found it was totally safe, which is why I think they're willing to give it authorization right now. But what's interesting to me is why move forward until they've seen data that it's protective?
Yeah, that is the big question. I think for up until just recently, I think the thinking was let's wait to see what that 3rd dose data sort of shows here. I think that the belief is that look, we have this other data from older children. We've seen what the boost, the 3rd dose might actually do. Should we wait to get that third dose data, which probably be end of March or even later than that? Or should we say, based on the fact that we see that the safety data looks good, it's 2 doses, while in 6 months to 24 months did provide good immune response, the older group did not get a strong immune response. Should we wait on that 2 to 5 year old group? Or should we say, let's just give them the 2 doses now, or at least get that authorization so that ball is rolling, and then wait for that third dose information to come back? They may have to adjust the dosing ultimately on this. They may adjust the number of doses. We'll see. But the question is, do you wait for all that data to come back when you have the numbers of cases that I just showed you, or do you just start getting things rolling?
Yeah, it's such an important question. I will tell you, I can't wait. And I think the expectation for so many people, having looked at what happens with other groups, is things will go in that direction, right? So that's the hope.